Hey, we had our first yoga session earlier.
Oh, really? That's nice. How was it?
I'm really amazed on how they do different stretches, and I wonder how come our superiors can do really perfect splits while most of us can't?
Oh, it's called the range of motions.
What is that?
If you want to know more about range of motion, listen to this. Hi, my name is John Angelo Maraña, and together with my group mates, Natividad, and Earl Rufin, we are going to discuss the range of motions and the three different kinds of range of motion exercises. What is range of motion? Range of motion refers to how far you can move or stretch a part of your body, such as a joint or a muscle.
In addition,
Physical therapy involves several kinds of range of motion exercise. Among these, one of the most useful are exercises that improve and facilitate the range of motion. The range of motion is the phrase physical therapists use to describe how much movement you can make with the joints or part of your body. When your range of motion is affected, you will find that it isn't possible to move a particular body part comfortably around its joint.
There are three types of range of motion: the passive range of motion, active range of motion, and the assistive active range of motion.
reminder,
Always remember to ask permission to your patient if it is okay to touch them when performing some exercises. Here are some examples of passive range of motion. First is shoulder flexion. Put your right hand in the bicep area and one near at the wrist. And we will just flex the shoulder. Flexion, extension. Flexion and extension. Next one is the hip flexion. First, put your left hand under the leg and your right hand near at the foot of the patient. And we'll do is flex, extension, flexion, and extension. The next one is the dorsiflexion. First is put your right hand at the heel part of the foot and flex it. One more. The next one is the plantar flexion. Put your left hand here near at the heel part and your right hand at the beneath the foot and flex it. One more. When we use passive range of motion, if you're dealing with the aftermath of an injury to your shoulders, knees, hips, necks, or any other part of your body that's home to a joint, then you know how easy it is for your range of motion to be affected. That's because the range of motion, or the distance and direction a joint can move, is often limited after experiencing trauma to that area. To get a better idea of the impact of a particular joint, a doctor, physical therapist, athletic trainer, or other qualified health professionals can measure the amount of movement in a joint or body part to see if there is a limited range of motion. This is typically done during a physical assessment after an injury or as a part of a rehabilitation program. If your range of motion is limited, you'll benefit from spending some time performing a series of passive or active range of motion exercises to get the injured area healthy again. A physical therapist will use this type of exercises as part of your overall treatment plan. Cons of passive range of motion. Where you're not in control of a movement, there's a greater chance of injury. Another person can tell what your limit is and may move a muscle or joint farther than it's able to go. Stretching a little beyond your limit is good for increasing your range of motion, but pushing too hard may lead to a muscle tear or damage to a joint. This is a risk in active assisted range of motion as well. No one should push you to the point of pain.
Active range of motion. It is the movement of a joint or body segment produced by active voluntary muscle contractions by the patient within the unrestricted normal routine.
Active range of motion is a range of motions that can be achieved when opposing muscles contract and relax, resulting in joint movement. What are the benefits of active range of motion? First, it reduces pain. Second, it improves our circulation, improves our physical performance, improves our muscle strength, and reduces stiffness. Those are the benefits of this type of exercise. Here are now the examples of active range of motions that I will be performing. This is hip rotation, and hip flexion and extension. And head rotation. That are the examples of active range of motion.
Active assistive range of motion. Active assistive range of motion exercise are more progressive, intended for the client to perform movement around the joint with some manual assistance for the physical therapist or form a strap or band. The exercises can often feel painful, and the muscle can feel weak. Increasing range of motion with this exercise should be a gradually advancement. Cervical motion exercise. In this motion, our hand should support the head of the patient and stand behind the patient's head. I do first the cervical motion. The first thing we should do is to meet the patient's chin to his chest. Just like this. And then count 1 to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And the next is the cervical extension. Cervical extension is very important that will create space between ourselves and to the patient bed. And now do the cervical extension just like this. You can also ask your patient if he can count 1 to 10. Sir, can you count 1 to 10?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
The next is cervical rotation. In cervical rotation, using my closed hand should be a little wider for me to access the movement easily. Your hand should be positioned like this. And rotate the patient head. Can you count 1 to 10, sir?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
And do this again in the other side. The next ROM exercise is lumbar rotation. I will put my left hand into the shoulder of my patient and my right hand is to the hips or pelvis of my patient. Like this. And pull it towards me.
Oh, nilagay po.
The next ROM exercise is thoracic rotation. I will put my left hand in the back of the head of my patient, and my right hand is the shoulder or the scapula of my patient, and I will rotate it towards me.